So a few weeks ago I did a video for Davidson County Medical Ministries in Thomasville, and another awesome place who's trying to help out people who either don't have health insurance or can't afford it in Yadkinville reached out and asked me to come up and do a video showcasing them. So this isn't our normal Davidson County spotlight, but it's just a neighbor up the road a little bit who, you know, want to talk about what they do and hopefully get some people interested in helping them out. What's up, guys? So I'm actually at Hands of Hope in Yadkin County. They're a nonprofit funded just by donations and just grants and stuff like that to help people who don't have medical insurance. So this is Marty, who's the executive director, and this is Jennifer. And yeah, so tell me what you guys do here.
Jennifer?
No, go for it.
Well, we see citizens of Yadkin County who are uninsured, have no medical insurance, no disability, and we welcome them to come to our clinic so that they can get medical care. We're like a primary medical facility.
Awesome. So Jennifer, you're the medical provider here, right?
Yes.
Okay, so tell me kind of what a typical, like you guys are only open on Tuesdays right now.
Right.
All right,
Yeah.
so tell me kind of what happens on Tuesdays.
So on Tuesdays is usually our chronic care day, so people that's already been established comes in with chronic care conditions, diabetes, hypertension, other things like that. They come here to get followed up with the medication or just visits or problems. We also have walk-in clinic that day. People comes in for acute issues from sinus infections, injuries, pain, whatever they need to be seen by that day too.
Okay, so like another place that we've done a video on, like they had to come in and had to do a whole application before they could come in and everything else. Like you guys will take in walk-ins. Right. Like what would someone need to bring?
The only thing they would need to bring is a photo ID and an address that says that they're a Yadkin County resident. That's the only thing we need. We don't do a lot of background checks. We don't need a lot of paperwork. You know, we trust them to tell us they're a Yadkin County resident and they need health care.
Great. So give me a little history. Like how did you guys start this?
Well, it was started about 8 years ago with a resident that lived in the county going to nursing school, decided that the community needed a free clinic. So he started in a small church and people would line up in the afternoon just to be seen. It was first come, first served. They set up the clinic, took care of the patients, then broke down the clinic at the end of the evening. And that went on for several years. And then through grant awards, they were able to move to a more permanent place and set up the clinic. And that's when they started the chronic care clinic. And so we started to schedule folks. Then last year, we moved to this new location and added Jennifer as our chronic care provider, and we share her with the Yadkin County Medical Clinic. So it works out great.
So Jennifer, you're just busy all the time.
And she loves that.
And you're just busy taking care of people all the time.
Yeah, pretty much.
That is great. That is great. So let's take a quick tour of the place and kind of show everybody what's going on around here.
Okay.
All right. So Jennifer, this is one of your exam rooms, right?
Right.
All right. So in here you guys have, well, obviously the tone depressors, everything else, and like we were saying, you see how many people again? Like
20 patients.
That is so many. And you have how many of these rooms? You said 2?
So there's 2 of these provider rooms, and then 1 room is just kind of an extra room we use for anything that we need as far as procedure or test or anything.
Great. So tell me about like everything in this room, like.
So we have our room next door where we do the blood pressure, height, weight, all the other vital signs, and then they come in here.
Yeah, let's not put me on anything that has to do with weight.
Yeah. So then they come in here just to see the provider. So, we have an exam table like a normal doctor's office. We have pretty much anything we need to do examinations with, physical assessments with, have the computer that we use for a medical record system, and that's about it.
That's awesome. And I hate to bring this up because everyone's always talking about it. But we had COVID this year.
Right.
And it was, so how has that affected how you guys have seen patients?
So we stop everybody at the door, ask them if they've, kind of the normal questions, if they've been exposed, if they have symptoms. We take their temperature and we give them a mask. If they do have any symptoms, we have another room that we'll take them to keep them isolated from everyone else. We do cleaning after each patient and things like that, just the normal precautions that.
Yeah. Is there anything that you recommend other than the wearing the mask and sanitizing and just being careful and keeping distance?
Yeah, just the mask, sanitizing, and social distance. And if you have symptoms, stay at home.
Well, you heard it from a medical professional here. Wear a mask and keep your distance. All right. So great. Let's. Anything else you want to show us?
No, our other room that we also use is we have another provider that comes in on Monday who speaks fluent Spanish. So we have a big population of Hispanic patients.
That's great.
So it's helpful to have somebody that's fluent in Spanish and knows the culture and knows the people. And
now on Mondays, is that still walk-in or is that
just chronic care? You have to have an appointment to come in. So we try to schedule some of our Hispanic patients that only speak Spanish with her so she can communicate better and treat better.
That's awesome. That is so great. So I guess we'll go take a look at some of the other stuff in the building.
Okay, sounds good.
Marty, we're in the pharmacy part of Hands of Hope. We were saying earlier, like, that you have most stuff like diabetes or heart pressure medicine, antibiotics, something like that.
Right.
Like, normally, what do you charge for your prescriptions for your patients?
Well, that's the good thing about Hands of Hope. We don't charge anything. The medicine is free too.
That's great.
Yeah, no, and people find that very hard to believe. A lot of times they will ask when they pick up their medicine, what do I owe you? But that's part of the clinic. When it was started, they wanted to do everything for free. So once our provider writes the prescription, it comes through to our pharmacy. It's printed off like a regular prescription. We have a computer system, we have a label system to put labels on the bottles, and we have volunteer pharmacists that come in every Tuesday evening to check what we've prepared. We have a couple of pharmacy techs who get everything ready, and then the pharmacist comes in the evening and checks everything to make sure it's correct. Then we pop it up in our bins, and then on the following day, or even that evening, folks can come in and pick up their medication for free.
That's awesome. So you're giving this to the community for free and everything else. Like, how we talked about, you have some grants and some fundraisers, and I know I talked earlier with Jennifer about COVID, and I'm sure that it's been rough on everybody. All the nonprofits have had a hard time raising money this year. But you have the grants, but you also rely on donations.
Oh yes, absolutely. And unfortunately, donations have been down this year, like you would imagine under the circumstances. But then there's been some new grant opportunities related to COVID. So that's kind of bridged the gap for us in the meantime.
That's good. That's good. But in the future, I mean, you still need donations, because if you want to expand, I mean, because right now you can only see people, like, you're only open on Tuesdays and Mondays for the Hispanic population. And you're doing a lot of great good, but I'm sure you guys would want to do more.
Yes, that is our goal. We have a strategic plan, hoping that in the next 3 to 5 years we can be open 3 to 4 days a week. Absolutely.
That'd be great. I'm sure that'd help a whole lot of people in Yadkin County.
Oh yes, oh yes.
Well, thank you so much. Jennifer actually had to run, so she's not going to be here to say goodbye. But thank you so much for letting me come in and show everybody what you guys do here.
Thank you, Matthew, for coming. We appreciate it.
Not a problem. All right, so we'll see you guys next time.